Welcome back to Little Growing Bones, or welcome to Little Growing Bones. So millions of children undergo surgery every year. The clipboard hits the counter, you glance at the 6-point font, and 30 seconds later, you've signed your name like you're buying a phone case. So that moment is very daunting. That moment terrorizes very many parents because they know what they're signing away, but they have to sign anyway. So my name is Judith Nasazi, a pediatric orthopedic surgeon, and today I'm here to tell you the 10 truths that most parents never hear until it's too late. But first, what is consent? So consent simply means giving permission. In healthcare, it's about making sure that you as the parent or guardian understands the surgery, the risks and the benefits, and that you are agreeing for your child to go ahead. For all the children and teenagers, doctors may also involve them during the discussion so they feel included in the decision making about their own bodies. Surgery is a very big step, so consent protects your child and protects you as the parent as well. It ensures that you're not in the dark, that you're aware of what to expect, and that you've had a chance to ask all the questions that need to be asked. So it's not just a signature on the form, it's a conversation. So truth number one, consent is a chat, not a receipt. So whatever you say, things like, Doc, where do I sign? I get it. Trust feels good, but consent isn't polite paperwork. It's the law saying I must spell out the problem, the plan, the perks, the pitfalls, and all the other options, including not doing anything. So if you can't repeat those 5 things back to me in plain English, the consent isn't what the paper is printed on. Treat the clipboard like a pause button, not a speed bump. So look at me in the eye and say, run it past me one more time. We're trying to explain until you can teach it to your neighbor. So if you can't, then don't sign. Truth number 2, risk isn't statistic, it's a scenario. So infection, nerve damage, going through second surgery, consent, they all read like a horror movie, yes. And patients love to ask, how often does this happen? How frequent does this happen? But picture the aftermath after this has happened, like if your child has to go through antibiotics for nearly 3 months because of an infection. They're probably going to miss school, they're going to miss sports, they're going to miss all these other things. So understand clearly what you're signing away. Therefore, ask the doctor to walk you through like it was any other day, and what happens if things go south. So you need to understand all those scenarios. A decent surgeon should be able to explain this without flinching. You're not buying a car, you're buying a future that you have to live with. Truth number 3, alternatives aren't always safer, but you still deserve the menu. So doing nothing is always on the table. For example, if you choose not to have surgery for an ACL tear, then you know the downsides of the child having a brace, for most of the games they have to play. Then you also understand the benefits that would come from having surgery, all right? Another scenario might include like your child has a simple distal radius fracture and the doctor is recommending surgery, but there's also literature that shows that this can heal very well without any surgery. So it's weighing those pros and cons and knowing which one will benefit the child better and reduce the risk that they're going to be exposed to through whatever intervention that they might get. The 4th truth about anesthesia. Anesthesia is a separate deal and you're signing twice. So the anesthesiologist is a different doctor with different paperwork. So ask 3 quick questions. Does the child get a tube or not? What's the nausea rate for this age group? When do I get to see the child again? So some hospitals let you go in and stay until the child is asleep, others don't. So if your presence helps keep your child calm, request it early. If the separation melts your heart, then ask for something to calm your nerves. These details tweak the emotional memory more than the medical chart, and they're all negotiable. The 5th truth is that you can and should write on the consent form. So that page isn't stone, it's more like a dinner napkin. So ink is in condition, like things like procedure should be done by so and so, and ask for pictures before closing if you want to see. So seen parents index steps to the forms. If there's pushback, that could be a bit of a red flag. So a confident surgeon loves the clarity, and it helps keep your child safe. So take pictures of things, take pictures of amended charts, if you're allowed to. So if this saved you a headache, hit the subscribe button and leave your questions down below, and you can always answer them anytime. So the 6th truth is bring your child to the conference when it makes sense. So 7-year-olds get a cause and effect. Like we can explain to them like we need to fix the bone so the arm can go straight. For teenagers, it's about the social currency. So let them pick their pre-medical, their pre-med flavor, their cast color, bubblegum versus strawberry scent. So studies have shown that studies show perceived choice drops the post-operative meltdowns by nearly a third. So if the surgeon ignores your child and talks to you directly, then maybe the surgeon that you should think twice about working with. The seventh truth is recovery doesn't start in the recovery room. Ask for the rehab roadmap today, like know the day the cast comes off. Nerve blocks wearing off at midnight. Ask about pain management. Look for tutors way ahead of time. Grab the physiotherapy script now. Don't wait for when we're just starting. Not when you're hunting between appointments and removing stitches, or when they're doing sports. So a written week-by-week checklist cuts the parent stress by nearly 40%. We've just got the template, so just ask. The truth 8 is you can yank the consent at the last second, even on the gurney. So until the anesthesia medication goes in, you can tap on the bed rail and be like, I pause, I need 10 minutes. So the room freezes, nobody operates. Hospitals clearly hate delays, but ethics beats schedules every time. So if you're feeling steamrolled, bring backup, bring the grandparent, bring friends, bring a pediatrician to come for you. Says always evaporate the intimidation very fast. So forward this video to the next parent who is very anxious and pacing the corridors before the child's surgery. The numbers do help comfort, but shared war stories get us through the waiting room. Truth number 9, your memory is toast. So photograph everything. Stress hormones turn brains into Swiss cheese for some reason. So snap every page, take a picture of the wristband, take a picture of the post-op sheet, label a phone folder with the surgery date. So when the school nurse phones you in the middle of February asking when the plate went in, you'll have answers before she finishes the question. So 2 seconds of taking pictures beats 2 hours of hunting this down. So just be mindful and take pictures of people like the staff or places you clearly shouldn't be taking pictures of. But if you're allowed, please take pictures because you'll very quickly forget. Truth number 10 and the final one, trust is earned, not gift wrapped, and you're the judge. So I want your trust, yes, after I've shown respect, I've shown numbers and maybe a joke or two. So ask how many of these I did last year, what our infection rate is like, whether I got stuck in the hardware company if I'm insisting on doing surgery and putting hardware. Honest answers build the team your kid deserves. If I Bristol, then you can leave. Pediatric orthopedics can be found anywhere else. So if you feel some reluctance, then look for another surgeon. So your kid can't veto this decision. So your skepticism is part of the safety gear. We're teammates, and teammates challenge each other to try and keep the team safe. All right. So those are the 10 truths. What are your rights as a parent? You have the right to take your time before you sign. You have the right to ask for explanations in plain language, no medical jargon. You have the right to request one interpreter if you're not comfortable with the language that is being used. So you also have the right to refuse or delay the surgery if you're not ready, unless it's an emergency, of course. So at the end of the discussion, if you agree, you'll sign our consent form. This is a record that the process took place. But remember, the form is just a paper. The real consent is the conversation that happens before you sign. Consent isn't a ritual. It's the second you trade panic for a plan. So ask loud questions, scribble on the form if you must, bring your kid along, and remember, you can hit pause until the answers feel solid. Walk into the OR hallway knowing that you've done the bravest thing a parent can do. Make informed choices with love, but not fear. So if you've picked up even one question to ask, we both win. I'll be the one in the waiting room, coffee in hand, and ready to get your kid back to the playground. So thank you for watching, and until next time, keep it to little growing bonds.